I would encourage people to ask for a uACR test, again, because it's going to check the protein in your urine, which is very important to how your kidneys are functioning. And so it's important to know, because if you have kidney disease, you need to know where you're at, and you want to maintain. You don't want your kidneys to fail by any means. So it's important. It's an important test. I say it a lot. It's important to know your numbers. And again, it's important to do your research and educate, because a lot of people have probably had this test done. They don't even know that they've had it done. And if they did, and if their doctor talked to them about the results, they're probably still in the dark going, what does any of that mean? So I'm an advocate and educate type of gal. And that's all due to my first cardiologist. When they found my aneurysm prior to my first open heart, what he said to me is, when you leave this appointment, I want you to go and educate yourself. And it was important, because if I would not have taken some of that initiative, me and my family would have been completely in the dark. So it's important. You just got to know when they're talking to you what they're talking about. Again, this is our only body, and it's important for us to take care of it. So when I come across those providers that kind of, when I'm trying to advocate, but they're kind of pushing back, it's disheartening. And you get to the point where you just kind of want to throw up your hands and say, okay, you win. We'll do it your way. But my health got so bad because I just kind of threw up my hands and said, okay, whatever you say. And another provider that I actually worked with in the healthcare system said, oh no, ma'am, you have to talk to them. You have to advocate. Here's what we're gonna do. It's important you gotta keep pushing. It's affected my health outcomes because I've just learned to be more diligent, and I know what to be diligent about. It really comes down to just knowing what my lifestyle needs to look like, and not looking at it as following a diabetic diet, a heart diet, changing my lifestyle. So I've had other people to encourage me to do that. That's why I feel like it's important for me to help other people do it as well.